Hello everyone. In this video, I would like to talk about a question might be asked during your categorical track interview. So the program director may ask you if you want to be a physician scientist in the future. So they may offer you another interview for the physician scientist track, or during the physician scientist track, they may ask you if you want to be a physician scientist. So I would say that it could be happen during our interview. So just be careful. And here I want to give you some suggestions. First, just follow your heart. If you really want to become a physician scientist, and you can say yes, and you can definitely say no if you have other plans. For example, if you just want to be the clinicians and you have no interest in research, you can see that I just no. You can say no, and if you want to do the research in the future after the clinical training, probably you can see that I currently have no plan of that, but I will try that later after clinical training. But always you give them some reasons. You can tell them your research background, your story, or else. And at the end of that, you can see if you really want to become a physician scientist, you can see that I would like to help my future patients based uh, based on my based on my research experience. Or if, for example, if you want to design a new treatment plan or new medication, you think that could be helpful for your future patient, and also you want to contribute to the medicine or others. So here I will give you my answer for this question. Hey, Dr. Cui, may I ask you if you want to become a physician scientist? Oh, definitely yes. So actually, that's all what I want to become in the future. Want to be in the future actually. So you see that when I was in med school, I made it. I found that myself very interested in the cardiovascular medicine. So that's why I went to the university in the U.S. and completed my PhD study for the cardiovascular diseases. So so after that, so during the research, I found that there are a lot of space for me to do the research on cardiovascular medicine. So after the graduation, I made another decision that I definitely want to become a physician scientist in cardiology, and that's why I went back to my home country, complete internal medicine residency training, and also that's why I came back to the U.S. again and continue my research and also continue my clinical training and in training in the New York City. And also I'm currently for scheduling with my advisor on his service in cardiology and CSU. So I would say that to become, I would say that all of my career path just focus on this purpose. Um, I'm so that's why I did I did both clinical and research training during the past I would say during the past 10 years. So yes, I definitely want to become a physician scientist in the future. So you can see that in my answer, I give the interviewer uh, a, uh, a, I give you a I give the interviewer my own answer that I want to become a physician scientist, and I use a lot of evidence and reasons to support my point of view. And also I mentioned that all of my career path focus on this purpose, and just to convince the interviewer that I have been prepared for a longer time for this purpose. So I'm very well prepared, and I'm a very strong candidate. So I definitely have enough reason to continue my clinical and research training as a physician in the physician scientist track. So that's my answer. So I hope it's helpful on your answer as well. So good luck.